This episode of the Barry Chronicles is proudly brought to you by Bariatric Support Australia.
Hi everybody, I'm Tash.
And I'm Damo.
And together we are so excited to bring you this week's episode of The Barry Chronicles.
This week, talking to Dr Roy Hopkins.
As far as the lifestyle changes and things that take place after bariatric surgery, or what is the process that you like your patients to go through, like the pre-op and then that post-op period? I know that would be handled by predominantly probably by the dietitian, but what are the stages of recovery?
Okay, yep. So an initial talk, we have a discussion first.
Yeah.
A free and open discussion about what they want to achieve. And I go through actually what their diet's really like.
Yeah.
And kind of drill down, really drill down, get little tidbits out of them about what they're actually eating and how they're eating it.
I think it's really important. I mean, when I went in with my surgeon, I was extraordinarily blunt. I just told him exactly what I'm eating, what I was eating back then. I just told him, because by that point I didn't care anymore. It's like I'm done pretending. I'm here because I need to be here, because I was eating a lot of food. And so I was just honest about that.
Well, I lied my ass off about it when I saw my
I love it so much, Damo.
I thought if I say too much, then they'll think it's psychological and I won't get my surgery. They'll send me to a psychologist instead. But so for breakfast, I would say I have some Wheat Bix and milk and maybe a piece of toast. Well, the reality was it was like 10 Wheat Bix covered in maple syrup with a nice splash of cream and milk, and then maybe 4 pieces of toast. Lunch would be a chicken and salad sandwich, which was actually,
a
grilled chicken burger from Macca's or so, and then some.
I love it. I love it so much.
A piece of steak and some roast veggies for dinner. A 500-gram steak at least. I would look for the biggest piece of steak that I could find. Eat the lot, and the potatoes that were with dinner were actually jacket potatoes, which had sour cream and bacon and butter. I knew that the surgeon knew that I was lying, because you don't get to be over 200 kilos by eating small portions.
Yeah. But there was just so much shame. Like there's just so much shame. So when people come to you, that they don't need to feel ashamed, do they?
No, I would rather they were honest. And most surgeons have a good, can I use the word, BS detector?
Yeah.
We're observant people. That's part of our job, to observe, health conditions. And there's little words like, I eat some. I'm like, some. Or, I eat this. I'm like, oh, yeah, okay. But work with them. And so I kind of drill down very specifically if I can get it out of them. Open-ended questions are always the best, rather than asking closed-ended questions, because you find more information out. And then you find out that they don't snack during the day, but they're a big snacker at night and might eat a box of Tim Tams at night. Okay, well, that's what's happening, But then why are they doing that at night? And that's the thing, working around their food habits. Then we can have a talk with the psychologist about those habits and working on those habits as well.
Yep, fantastic.
And that's the really big thing. It's changing your habits. So, very much so, and working around volumes of food, but then also being quite honest about what they're going to be able to eat afterwards.
Yeah.
Explaining to people that drinking beer afterwards is probably not going to make them feel great, especially any carbonated beverage isn't going to be great. And there's particular foods that won't make them feel great.
Well, while we're on that, because it's something that comes up all the time, isn't it? Like daily on our support group, every day, is I'm 2 weeks post-op, when can I have my first alcohol?
Mm-hmm.
Or I'm going to, I'm 2 weeks post-op, going to a party this weekend.
Is it okay?
Is it okay for me to drink? When I had my surgery, and I'm coming up to 10 years, and I've maintained the weight that I'm at for about 6 years. So
it's a long time.
When I say, well, what I did, I had no alcohol, no carbonated beverages for at least the first 12 months. And I don't actually remember because it was such a long time. I know it was more than 12 months. Then people get upset with me because they're like, it's not what they want to hear. But I always wanted to make the most of my sleeve, of what I'd been given. And back then I was told, well, you lose most of your weight in the first 12 months and then sort of half of what you've lost in the next 12 months. And I found that to be fairly accurate for me. And I was just like, well, if I've got to spend 12 months without having alcohol and that to maximise this tool that I've been given, small price to pay.
Yeah, well, I think it is, but that's my profession, isn't it? So I haven't walked, as I said earlier, I haven't walked a mile in that person's shoes.
Yeah.
I don't know, is it a social thing for them? Is it a coping mechanism for them? What is the reason for them drinking the alcohol? And you try and unpack that. Again, try and unpack that and then educate.
Yeah.
If you've had a sleeve, the carbonated beverage is going to make you feel pretty rotten, to be honest, especially soon afterwards.
Yeah.
I still, if I took a mouthful, then I'm getting the pains down my chest, and that's 10 years later. So
a common question that's asked, and I would love to know the answer to this one, is, can carbonated beverages stretch our sleeve, our bypass pouch?
I don't know. Am I going to get into trouble? Look, theoretically, because it's muscle. Anything that stretches muscle and consistently stretches muscle, could conceivably do that.
Yeah. Yeah. So I think that that's probably the because I'm nearly 6 years post bypass now, and that's kind of the assumption that I've made over the last few years, is that if I was to have something consistently, like if I was to consistently push that feeling and consistently do that over a long period of time, I think that it would become less and less of a feeling, which I associate with, I've probably stretched it at that point.
Yeah, no, quite likely. But the other thing is, you've got to be pragmatic.
Yes.
I'm not the health police.
Exactly. Yep.
You've got to work. The human condition is imperfect. And, the old saying is, to err is human, to forgive divine.
Yes.
People are going to have indiscretions. You just got to be realistic about that. I would hate to say, no, you can't have a toast of champagne at your child's wedding.
Yeah. 100%.
You've got to be practical and pragmatic about this. You can be rigid and inflexible, or you can work with people and educate them.
Yeah.
And so, as long as they're keeping on the trail by and large, everyone's going to have an indiscretion at some point in time.
Yes. Yep, I agree.
You can't come down on them.
I mean, I was I think 4 months post-op when I had my first drink, and it was an event. It was at an event, and it made me feel fairly rotten. And I found out that I am now a one-pot screamer. So that was
not unusual.
That was also, wow. Okay, that was
not
interesting.
Unusual.
But from that, I learned that I probably only go down that road a couple of times a year at special events.
Yeah.
Just because it just didn't feel great.
Yeah. But you've made that decision yourself as well, 100%. Because it didn't make you feel great.
Yeah. Yeah, that's right.
Sometimes,
but what it does for someone else, well.
Yeah.
Yeah.
Oh, and absolutely. What it does for everyone's unique. We tell ourselves, we tell our children, we tell everyone around. Everyone is unique because it's true. Everyone's unique. And everyone's got their own moral compass. Everyone's got their own desires and wants and the dislikes, and we work with them as people, as a human being. Every human is multidimensional and multifaceted. They're not two-dimensional.
That's so wonderful.
And so I work with them. I work with them as a person, and if they come and say, I've done this, I said, well, okay, how did it make you feel? And they said, right. And I said, you've probably learned your lesson then, haven't you?
Yeah.
You've it's like you've learned your own lesson out of that.
Yeah.
Don't do that again.
Yeah.
And sometimes they're the most powerful lessons because
I agree.
But that's with everything in life. We can tell our children and our loved ones, don't do this, but until they do it and they see their own repercussions of it, then they learn the lesson.
Yes, that's very true. It's very, very true.
Something that I was asked actually just this week is, why is there the need for the puree, the soft, for those stages afterwards?
Liquid, puree, and soft.
People sort of, they struggle with it so much. And then they hear...
Puree's horrible.
Then they hear someone that didn't do any of those stages. I just went to solid food. And, so...
Just chew it well.
Yeah, just chew it well.
So if you think about it, when you do a sleeve, the stomach's got 3 layers of muscles. So you're actually making a very tight tube that's kind of going like this all the time. And you don't have the ability to expand your stomach. So it's pushing down in a high-pressure environment down. The other really interesting thing about sleeves is there's some data that shows, depending on how far from the pylorus at the end of the stomach you start making a staple line, that can also change your gastric emptying time and how long it takes your stomach to get rid of the food. Okay. So if you've got more solid food there, it can take longer for some of it to empty some of the time too. And what you want is don't want to stress any of the joints either, the staple line. You don't want to stress any of the surgical aspects of the operation.
Yep.
That sounded very simple, didn't it? Sorry. You don't want to stress the staple lines,
it's actually
like that. And also the anastomosis, the join. You want things to go past that easily without any inhibition whatsoever. In the human body, doesn't matter what you do. It takes 6 weeks to heal. If you have a cat scratch, it may look like it's been healed, but underneath, your immune system is still working for 6 weeks.
Okay.
Any operation. I do a lot of fundoplications for reflux and hiatus hernias, and I have my patients on I'm maybe a little faster than other people to progress them, but my standard would be clear fluids the day of operation, free fluids the next. If they're doing well, and they are doing really well, then I'll let them have pourable puree. Puree is a funny thing. Puree means different things to different people. To some people, it means mashed potato on a spoon. If you threw it at the wall, it would hit the wall and stick solid. That puree. Whereas actually, puree to me means you should be able to pour it off a spoon, and it should pour, and that's the consistency.
Okay.
Yep.
Awesome. That's great to know. I mean, because that is something that comes up. That's a question that is asked a lot. Is what is puree? What is puree? What's classed as puree? I heard one person say that it needs to have no lumps and be able to go up a straw.
Well, that's very reasonable. That's if it can go up a straw and you can suck it up a straw, it's going to fall off a spoon.
Yeah.
And obviously, then it would go down where it needs to go relatively easily. And
And if you've had a bypass, it depends how big the anastomosis is as well. If you're going to go straight to soft diet, and you're going to say, and then it depends what everyone thinks is a soft diet. That's the other thing.
Yes.
What do they understand by a soft diet?
So explain that one to us.
I think a soft diet is something that's very easily chewed, masticated into their mouth, and semi-pureed as it goes down. What I tell my patients is a soft diet. I liken it to if you got a piece of meat and put it in a slow cooker for 8 hours, and then you can pull it apart. Pulled pork, pulled lamb with lots of gravy. It's got to be able to eat easily. I've had episodes of people thinking they progress their diet faster and eating a sandwich or a bun of some kind and getting into trouble. So can't be the police about these things. but I try to be very
No,
educational
no,
for
I mean,
them.
of
I think
course,
it's for their benefit.
yeah, like not being the police at all, but just giving guidelines around what it is that they should be aiming for in terms of the texture and the consistency of the food.
Yep.
Because I know I found that I found the information was a little bit difficult to follow, and I on puree definitely ate things that were not loose enough in texture.
Yep.
And I just found that it felt like it was a stone. And then I managed to throw up. I know you're not meant to be able to do that when you've had bypass, but I can.
Yeah. Look, maybe one of my things personal as a secret weapon is my wife's a speech pathologist, so I've got all that other data I can get hold of.
Oh,
And
right.
there's all the guidelines and all the hospitals have very clear guidelines as to what the stages of food are as well.
Okay.
And so
Yeah.
I try and tell patients very clearly that's what it is. Yeah, it's got to be a pourable puree. It's got to be the consistency that can get a big spoon, pour it off, and then a soft diet. It's got to be nice, really soft.
Okay.
Yeah.
Excellent.
That would be brilliant because, that's the first time I've ever heard that, and I've been doing this for 10 years.
Yeah.
The hospitals all have that data because you get not just in this line of work, but in other lines, rehab. People have had stroke. People have got dysphagia. People have got all those things. There are very clear guidelines on what constitutes each type of meal.
Okay, awesome. So if someone was unsure, they could definitely reach out while they're in hospital and ask for information on exactly what that should be.
Absolutely.
That's fantastic to know.
Absolutely. That information is freely available because the kitchens have to comply with that.
Yeah.
Okay, awesome. That's excellent.
Might find it and put it on our website too.
We might do that as well.
Yeah. But everyone's different, and and many of my colleagues might have different ideas as well.
Of course.
Yeah.
That's just my own personal take on it.
Yeah. But I think it helps when we can give people a starting point.
Oh, absolutely.
Because, for me, I was always confused with that. Just like the whole moderation topic. I always struggled with moderation. For me, it was the end of the Tim Tam packet was my moderate amount. The bottom of the iced coffee container. So I always struggled with those sorts of things.
Be real.
So
my moderate amount was the bottom of the 2-litre iced coffee.
Everyone's point of view is different because everyone's a unique individual.
Yeah,
and once
very
again,
much so.
it depends where they're coming from, and that's what I try and unpack. Where is someone coming from?
Yeah.
What's their point of view? Why do they have that belief? And it's also their reference point. Is everyone around them doing that as well, and therefore they think that's the normal?
Yeah. So do you think that I think that your opinions as a surgeon have probably been shaped by your research background?
Yeah, a little bit.
Yeah.
A little bit evidence focused.
Yeah.
Working
it's
out
excellent.
metabolism.
I think it's great.
We're talking 20 years ago, but I used to be able to write out the Krebs cycle, oxidative phosphorylation, gluconeogenesis, and I'd be able to tell you how many ATPs came off and the energy, but it gave me a better grounding for really understanding it. Yeah, being able to do that really has helped. And the genetics as well.
Yeah.
But the biochemistry and the genetics, but also microbiology and understanding the concept of the microbiome and what's normal and having a healthy flora, in your bowel. There are a lot of changes, and if you look at environment, species were introduced to control another species and they took over. Same thing happens with bacteria, right? Yeah. So it's understanding what the crux of it is, and it's a lot more holistic than a lot of people appreciate. It's not A then B, it's a whole environmental thing, and understanding that and appreciating that and working around that.
Yeah. So obviously our gut microbiome changes dramatically after our weight loss surgery.
Yeah. So the metabolism, the absorption, you know, most people understand it as either a restrictive procedure or a malabsorptive procedure, and understanding where the nutrients are absorbed. A lot of them are absorbed kind of more in the first part of the small bowel. A lot of things are absorbed there. Understanding the different chemicals, pancreatic enzymes, how they work, bile, how it works, stomach acid, how it works. You know, you need stomach acid, an intrinsic factor for iron. And by taking things away, you're going to have ramifications. But then you need to understand what those specific ramifications are for each operation and working around that. For example, your multivitamins, right? We know you absorb different vitamins, different nutrients differently. And that's why I believe everyone should have a very specific multivitamin tailored to their operation.
Yep.
There's different multivitamins for sleeves that there are for bypasses. And then you might need your calcium chews as well, or your calcium tablets if you don't like the chew or the taste of them. But everything is specific, and that's why everything should be tailored to everything specifically. And so understanding the concepts of that and understanding that has helped me a lot, I think.
So if someone is prone to an iron deficiency, for example, then are there recommendations of which surgery is probably best for them in the longer term?
Oh, not really sure. It depends on a lot of things why they're iron deficient. Is it the intrinsic factor of the stomach? Has someone got heavy menstrual bleeding?
Yes.
I'm not going to give you a straight answer on that because
that's totally fine.
Very specific considerations of why are they anemic? What is the cause of their anemia?
So isn't that interesting though? That obviously that is something that could be taken into consideration.
Yeah, then again, you know, you get people who have Crohn's disease. You got people who have, you know.
My husband has Crohn's.
Yeah, so you got Crohn's disease, and a woman, you could have fibroids that are bleeding. There are a whole lot of other reasons for having different metabolic imbalances.
Yeah.
And I think working through each person's case as a unique individual is the major thing. And working through why and what the process is to thought around what we should offer you or what we agree is a shared decision we're going to undertake together and why.
Yes. Well,
I could listen to this all day.
Yeah.
It's
I could bore you after a while. I just blab and go off topic.
I love the science behind it and why things do what they do. I've always been tell me why this is happening. And so was Tash.
I was constantly in trouble as a child because I was, but why? But why? I've always loved knowing and understanding why. And
that fed your knowledge and that fed your education, and that was probably a thing to be celebrated, wasn't it?
One of the things that I'm loving about this conversation is that it answers a very long-standing question that I know exists within the bariatric community, which is why can't it just be, why can't everybody just have the same approach? Why can't it just be the same? Why can't we all just have the same program, the same pre-op, the same post-op? And I've been even guilty of saying, you know, why does it have to be so different? Why does it have to be so hard? And you've answered that today without even me asking you that question. You've already answered that for me.
Well, I mean, we'll give you some examples. Why does not everyone get a bypass? Well, if you had metabolic problems and you had a lower BMI and we gave you a really powerful operation, you could end up undernourished and malnourished.
Yeah.
That's one example. You want to pick the right operation. Have you got other medical problems that you need to work with? One that comes off the top of my head is phenytoin or some mood stabilizing drugs like lithium. Now, sometimes the absorption of that is towards the proximal end of the small bowel, and that might change the metabolism of that. So you've got to take those things into consideration. There's also guidelines if you're on anticoagulants. Where are they absorbed? And what do you want? And why are you on it? Are you on it for a reason? And how can we work around that then? There's a whole lot of nuances to everything. And it's
wow.
And I think it's also interaction between nuances as well. I know it sounds like I'm faffing around, but it's just everyone individual, and it's working out exactly what each, why do they want the surgery? What are they hoping to get from it? What's their past medical history? What medications are they actually on, and why are they on them? Have they had surgery before? What are their other issues?
Yep.
Is there something that's also affecting them? Have they had a friend, a family member have one operation and have a side effect, and they don't want to have that, and work through that as well? There's a whole lot of everything. It's just, as I said, I try and treat it. I do treat everyone as an individual. N equals 1. Putting all the knowledge I've learned over the years, the technical aspects, and coming to the right procedure for that one individual.
Yeah. Do you think that there are some people where it just doesn't work for them?
I think working out and unpacking the people who are not going to get on board with, I hate saying the program, but who are not going to invest the right time and thought processes in it, they're not going to have an optimal outcome.
Yeah, okay.
Because at the start, I wanted to be what I considered my version of normal, and I wanted the surgery to do that for me.
Yeah. Okay.
And it wasn't until, I was going through a few issues that I realised that what my version of normal was not realistic. And I wasn't going to be like some of my mates that could go out, eat whatever they wanted with no...
with seemingly no...
no issues or
side effects. Issues.
And it took me a few years to sort of come to terms with the fact that what I perceived normal really wasn't going to exist for me, and I had to change my mindset around that.
Yeah, and I guess I try to educate people as part of the initial conversation about what we hope to achieve.
Yep.
Given everything works well, where do we think we might get you to?
Yep.
And then anything beyond that is up to them.
Yep.
And how much work are they willing to put into it? Go back to the analogy if it's a tool. How often are they going to use a tool? How well are they going to maintain their tool? Yep. A good, well-maintained tool will last you for a lifetime.
Yep.
But again, it's knowing which tool to use for which specific purpose. And working around that, I think, is the major issue. Being able to, and then coach someone that the new normal is not going to be the same normal as it was before the operation.
Yep.
There are going to be sometimes some drastic differences as to what they're going to be able to tolerate, and how they're going to feel. Counseling them, I think educating someone beforehand is the major issue, because then it's been flagged to them beforehand. And then back in the memory, we spoke about that.
Yeah.
Yes, we did speak about that. And being also, therefore, at the end of the phone or the email for anyone who's got a problem, that's my guarantee. We're in it together.
Mm.
You're not sent off into the wild blue yonder. Thanks very much. See you later. We're in this together. I've helped you, and I'm here for you. And being able to
it's very
happily
important.
have people call up, email, I'm having some issues. Can I come and see you? Of course you can.
Yeah.
Of course you can. I'd rather you came and see me than didn't. If I can help you, I'd rather help you.
Yeah.
And if it's something we need to get some other people involved for, I will find those people for you. Yeah. I've had the privilege of being allowed into a very sacrosanct part of their life, a major life change, a courageous life change.
Yeah.
And so I will do whatever I can to help them. And if there's any hurdles along the way, then we climb those hurdles together.
Yeah.
Yeah.
And we get through it as a team. And I will use other people and bring other people in as we need to. But we get through it as a team. And what I want at the end of it is to see someone who is much happier, healthier, energetic, and fulfilled, and has a better quality of life.
Yeah.
And realizes that there were some hurdles along the way. We've climbed them together, but look at where they are now compared to they were beforehand. And it's a life-changing thing. And that's what drives me.
Yeah, that's awesome.
I love it. Love it. Thank you for joining us.
Very welcome. Thank you for having me.
We've had a great time.
Thank you so much.
Yeah,